Imagine being trapped in a never-ending cycle of trauma, anxiety, and depression, with no escape from the devastating effects of armed conflicts, climate change, and natural disasters. This is the harsh reality for over 300 million people worldwide who are in dire need of humanitarian assistance. The mental health needs of affected populations have reached unprecedented levels, and it's imperative that we take immediate action to address this crisis. But here's where it gets controversial. For far too long, mental health has been treated as a secondary concern in humanitarian responses, leaving millions to suffer in silence. The World Health Organization, WHO, and its partners are determined to change this narrative with the launch of the Mental Health and Psychosocial Support Minimum Service Package, MSP, a groundbreaking framework designed to guide humanitarian actors in delivering essential mental health and psychosocial support in emergency settings. The MSP is the result of a collaborative effort between WHO, UNICEF, UNHCR, UNFPA, and a coalition of humanitarian partners who have come together to develop a comprehensive package that outlines a clear set of priorities and offers evidence-based tools to ensure that affected communities receive rapid, effective, and coordinated mental health interventions. A timely tool for humanitarian action, the MSP gives guidance to coordinate essential activities, ensuring that they reach the affected people. As Devorah Kestel, Director AI of the Department of Non-Communicable Diseases and Mental Health at WHO, aptly puts it, in emergencies, decisions need to be made quickly, and funding needs to be allocated so that priority actions can be taken. Humanitarian emergencies often overwhelm existing health and social systems, leaving individuals vulnerable to trauma, anxiety, depression, and other psychosocial challenges. The MSP helps humanitarian actors, from medical staff to aid organizations, identify which mental health and psychosocial support activities should be prioritized across different sectors, ranging from health and education to protection and community services. So what exactly does the MSP package include? The answer lies in its 7 core resources, which are designed to strengthen mental health responses in emergencies. These resources include a minimum service package, MSP guide, MSP workshop package, MSP sector-specific quick start guides, MSP monitoring and evaluation indicator bank, a multi-sectoral MHPSS assessment toolkit, a mapping and assessment report repository, and an MHPSS training database. Each of these resources plays a critical role in ensuring that humanitarian actors have the necessary tools and guidance to provide effective mental health and psychosocial support. The development of the MSP was made possible through the collaborative efforts of WHO, UNICEF, UNHCR, UNFPA, and an extensive network of humanitarian organizations, with financial support provided by the Ministry of Foreign Affairs of the Netherlands and the Directorate General for European Civil Protection and Humanitarian Aid Operations, DG ECHO. This joint initiative underscores the growing international recognition that mental health is a core component of humanitarian response, not a secondary concern. By promoting coordinated approaches, the MSP ensures that MHPSS activities can be rapidly deployed, scaled, and sustained in the most challenging contexts. As we look ahead to the future, it's clear that the MSP represents a significant step toward ensuring that affected populations are not only physically protected, but also supported mentally and emotionally. But here's the part most people miss. The MSP is not just a tool for humanitarian actors. It's also a call to action for governments, policymakers, and individuals to prioritize mental health in emergency responses. And this is the part that sparks controversy. Should mental health be treated as a luxury or a necessity in humanitarian responses? We invite you to share your thoughts and opinions on this critical issue. As humanitarian crises intensify worldwide, the MSP is a beacon of hope for millions of people who are struggling to cope with the devastating effects of trauma and displacement. By embedding mental health and psychosocial care into emergency responses, WHO and its partners are paving the way for more resilient, compassionate, and sustainable humanitarian action. The question is, will you join the movement to prioritize mental health in humanitarian responses? Share your thoughts and let's start a conversation that can change the lives of millions.